Hi, everyone. My name is Deidre Muirhead, and I'm the Community Health Education Manager for YWCA South Florida, Inc. We have on today with us Ms. Brianne Miller from Broward Regional Health Planning Council. Thank you, Brianna, for being here today. So we are here today for Wellness Wednesdays, and today's topic, we will be discussing HIV and AIDS. And we have Brianne here to help us understand HIV and AIDS and give us a little more information about that. Again, thank you, Brianne, for being here. Can you tell us a little bit about yourself and what Broward Regional Health Planning Council does?
Awesome. So yes, thank you for having me. So yes, my name is Brianne Miller. I am a clinical quality management health planner at Broward Regional Health Planning Council, or BRHPC for short. I work with the Ryan White Part A program for Broward County. So basically, for those that don't know, Ryan White was a 13-year-old boy who was diagnosed with HIV and AIDS after a blood transfusion in December of 1984. He was a hemophiliac and he was living in Indiana. So the doctors gave them six months to live, but actually what ended up happening was that he lived 5 years longer than expected, and he died 1 month shy of his high school graduation in like April 1990. He faced discrimination, age-related discrimination in his Indiana community, and his mom, Jeanne, pretty much advocated for her son and gained national attention. So Congress at the time in August 1990 developed the Ryan White Comprehensive AIDS Resources Emergency Act, or CARE. A lot of people know by that. And so there's Ryan White programs all throughout the country. And so for Broward County specifically, I do data analysis and report it to recipient office, which is Broward County itself. So that's pretty much what I do.
Thank you. So I really appreciate you coming on today to discuss HIV and AIDS with us. We are going to ask a few common questions. I think that not just myself, but a lot of the community is interested in knowing. When people ask or hear the topic AIDS and HIV, what exactly is AIDS and HIV?
Absolutely. So number one, I would say HIV is the virus that causes AIDS. It damages your immune system and it makes you much more easier to become sick. So HIV stands for human immunodeficiency virus. So this particular virus only affects humans and can weaken our immune system. And so our immune system is really awesome in helping our body to fight diseases, sicknesses, flus, cold, etc. So when it's compromised or weakened, you become more vulnerable to bacteria, viruses, or other agents that cause the disease. So after a while, when HIV is left untreated, it can really have a big impact on someone's immune system. And because of that, your body's less able to fight off infections. And so that's when it develops into AIDS, which stands for acquired immune deficiency syndrome. So that means that a person, their immune system has been made less effective by HIV. And so it's important to note that a person cannot have AIDS without being infected with HIV, the virus, right? Okay. So it's important to know that once you have HIV, it's with you for the rest of your life. There's no cure for HIV at the moment. However, there are medications that can help you stay healthy. Mm-hmm. And in particular, the medication can lower even some of your chances of spreading the virus to other people. And so a lot of times you hear the word undetectable. So that means that when your viral load, because remember, a virus has a viral load that replicates really fast. When it's undetectable, when you test, that means that the virus is no longer detected in your body. So that also means that you cannot transmit the virus.
So how does HIV and AIDS spread?
It's really important to talk about this because a lot of people think, it's through saliva or sweat, and that's not true. So typically HIV is carried in semen, vaginal fluids, mucus, blood, breast milk. So typically most people are diagnosed with HIV through anal or vaginal sex. Also people who share needle syringes as well, especially if you are using drugs, piercings, tattoos. Maybe you happen to get stuck with a needle that has HIV infected blood on it. So something to keep in mind, HIV is not transmitted through again, saliva or spit, sweat. It's not spread through hugging, holding hands, coughing, sneezing, uh, like touching the surface, like anything like that. If you don't know that you've been exposed to HIV, it's best to get tested. And there are a lot of free testing sites, especially in South Florida, AHF, AIDS Health Foundation, Care Resource, Latino Salud, the Florida Department of Health. There's so many free. You don't even have to go to your provider. You don't have to pay. You don't have to show insurance. So definitely want to put that out there. If someone is diagnosed with HIV, it could be years before they start to experience symptoms that make them feel sick, make them feel pretty much different. At first someone may feel itchy, a flu, feverish, etc. Typical early common symptoms are chills, fatigue, mouth sore, night sweats, rash, sore throats, and swollen lymph nodes.
Okay.
So when you are first diagnosed with HIV, and when I say diagnosed, I mean like the virus in your system, it's replicating so fast. So a lot of times a person can have a symptom that can only last a few weeks, and then they don't feel anything, but that doesn't mean you cannot spread HIV. Okay, so it's just really important if you are unsure, and we always love prevention, right? So it's always good to get tested regardless, but especially if you think you were at risk of being exposed to HIV, definitely get tested.
Do you think right now, in today's climate, that there's still a negative stigma surrounding HIV and AIDS?
I think so. I think that HIV was something that the epidemic definitely was much more prevalent in the 80s, in the early 80s, and because it was new to a lot of people, and it was affecting so many people that there was a lot of misinformation going on, thinking that it's just a quote unquote something that happens to someone who is gay or have sex with men, or people who, if you come from a particular place like Haiti or Africa, like it created this stigma that still is persistent. And because now it's 2022, it's been decades, and yes, there's a lot of advancements, but there still needs to be education. And because of the fact that people have these biases and these ideas that, oh, well, I'm straight, so I'm not gonna get HIV. I'm not gay. That's not how it works. One thing about HIV, it doesn't care your sexual orientation, your gender. If you happen to be diagnosed with HIV, if you have come in contact with someone that could have, the virus, that can increase your chance of actually getting it yourself. So it's really important to be educated and to understand what you can do in your own power, especially if you come from a marginalized community that is experiencing the stigma itself.
How common are false negatives?
This is a really good question, especially when we're talking about testing. So in general, I'll say that the HIV tests that we have are really accurate. I did a test, a thing about a month and a half ago, and it took less than 5 minutes, a rapid test. And of course, it was free. I did with AHF. And typically, negative test results have over like a 99.9% accuracy rate. Okay. And it depends on a couple different factors. It's the type of test, how soon the person was tested after exposure to HIV, and how a person's body responds to HIV. So when a person first contracts HIV, the infection is considered acute. So it's difficult to detect at first, right? So if it's Monday and you contract it, right? And obviously a lot of people don't know at the time, it may be difficult to detect it like on Wednesday, right? So over time, it becomes chronic, and then it's easier to diagnose. So it's important to know that HIV tests have this window period. So there's a period of time where a person is exposed to the virus, and when a test can detect the presence in their body. Okay, so once that person has, that window period has passed, it can produce a false and negative result. Okay, so for example, let's say you have contracted HIV, and then let's say you take a test next week and it's negative, right? It's in that window period. You're like, okay, cool. But then after a while, let's say a month later, the virus is replicating a lot in your system, and then you test maybe like 3 months later and it becomes, reactive, meaning that you are now diagnosed with HIV, you're considered, with that sort of terminology, that's when you're like, oh, okay, this is the actual result. And
Okay.
so I know sometimes that could be confusing because it's like, oh my gosh, I just tested 3 months ago and I was negative. Well, you were in that window period. So tests are more accurate when they're taken after the window period. Some tests have shorter window periods than others, and they can detect HIV sooner after exposure. So for those that don't know, a false negative happens when a person receives a negative result after being tested for the condition. They are less common than false positives, but typically they are rare, to be honest.
Okay.
So for example, if a person gets tested for HIV within 3 months of being exposed and the result is negative, the Department of Health and Human Services, they recommend to get tested again another
Okay.
3 months. And
Okay.
typically, in general, whether you're sexually active or not, it's always good to get tested by your local like primary
Provider.
provider, or you can go to an organization that does testing for free.
How can people help spread awareness for HIV and AIDS?
The main thing is, like what we said before, to be educated, especially on how HIV affects different types of communities. I know, especially, it's Pride Month, and a lot of times people who identify with the LGBTQI plus community, they are stigmatized. It's for a long time, there was misinformation, and almost some people and organizations were promoting HIV and AIDS like, oh, it's an abomination. It's because of your quote unquote lifestyle, why you have this disease, this gay disease, this X, Y, and Z. So now that we're in 2022, and then obviously, we have more access. A lot of people have more access to education through the internet, and then also through like local and like free resources, a library, for example. And so I think spreading awareness is educating yourself. So when someone says like, oh, HIV, like that's not even a big deal anymore, like ain't there a cure? It's like, actually, there's not really a cure right now, and also it's still a big deal. Okay, it's still something that is prevalent and specifically affects minority communities. So people who are Black, Indigenous, people of color, they are disproportionately affected. They have health disparities. And we access to testing, access to a provider, access to education, knowing how to use contraceptives and protecting themselves appropriately. So I think definitely starting with education, and also being confident in that education to speak up and then help other people.
What are the types of treatments that you would find when it comes to having HIV and AIDS?
Absolutely. So I don't know if anyone who's watching remembers, but there was a campaign with Nancy Reagan's like, just say no, like just say no to sex, just say no to drugs, just say no to everything, right? And even though abstinence is something that can definitely decrease your risk of being exposed to HIV, that doesn't mean that you cannot be exposed to any other way, right? But again, abstinence, you're not sharing needles, you're also using condoms the right way. You know how to use a condom, an external condom, internal condom, dental dam, stuff like that. And then also there are things called PrEP and PEP. So these are HIV prevention medicines. So PrEP, PrEP, is called pre-exposure prophylaxis. So it's a medication that you take every day. And so that helps you to protect your body if you were to be exposed to HIV. And then PEP is post-exposure prophylaxis. So based off that term, you can assume that, okay, if you were to happen to be exposed to HIV, right, if you think you can take this medication and within like a window of like 72 hours, that will decrease your chances of being diagnosed with
Okay.
HIV. So talking to your healthcare provider, or even like organizations that specialize in HIV and AIDS treatment, can give you the options that can be tailored to you. specifically. So obviously getting tested is really important. And with proper care and medication, people can live with HIV and have long lives. So
that's really good. And that's really good to know. I hope those watching, these are some really good notes that Brianne has been giving us. So take all of this information in, definitely share with your friends, family, and community members, because we want to educate as many as we can. And then, like you said, you basically said it at the end, that people can live normal lives with HIV and AIDS.
absolutely. Yeah, so there are people that live with HIV that can live, as long as their peers who do not have HIV. According to AIDS Map, people can live with HIV, have a similar life expectancy, provided they're diagnosed in a good time, they have access to medical care, and they're able to adhere to HIV treatment. And that caveat is really important as well. So right now, HIV is not curable, but there are modern therapies and treatments that can help people live long lives. So there's something called ART, that's antiretroviral therapy. So what that is a combination of medications that slows down the effects of HIV in your body that can help you stay healthy for many years. Okay, it can even lower or stop your chances of transmitting HIV to someone else. So remember how I was talking about HIV and a viral load? That viral load is replicating really fast, so it lowers the individual's viral load, right? And I talked about being undetectable. And so with ART, this antiretroviral therapy, it helps people to be undetectable, to not transmit the virus to someone else, and it can help them increase their quality of life. But this is important to remember that, someone has to be adherent to their treatment plan, and talking to your provider about tailoring a medical treatment plan that works best for them is so important. We have to also remember that just because someone's viral load is undetectable, that doesn't mean that HIV is gone. It's still present in the body. So if someone falls out of care, they stop their medication, their treatment, their viral load can go back up. Okay, and I'm talking about it can go from 23 to 50,000. Okay,
Wow.
100,000, right? And as a viral load increases, that can also affect how they feel. So it's really important to find the best treatment plan that works for you. Keep your viral load low. Also invest in yourself. Make sure you're getting enough sleep. Making sure you're having a nutrient-rich diet. Okay, and listening to your body, knowing when to slow down, take a pause, take a break, because our physical health, our mental health, our emotional health is all connected as well. And staying active, that's relative to you, moving your body, walking, biking, stretching, cleaning, all that can break a sweat, okay?
Yes, it can.
So make sure that you're keeping yourself as healthy as possible, so that way you can live as long as possible.
Thank you. This was very informative, Brianne. I really appreciate you and your organizations for coming on here with us today and giving us a little education about HIV and AIDS. Thank you, everybody. Have a good day. This is Wellness Wednesdays, Demystifying HIV and AIDS.